Hello everyone, my name is Shahid Nazir Mohammed, and I'd like to thank the UK Kidney Week 2021 organising committee for allowing me the opportunity to present this poster presentation on education, patient empowerment and best practice practice review 2021 and I think this is a fitting remit to present this work, and this work has several areas and focus, but ultimately has an overview understanding of how patient and professional best practices can be met through joint working, joint efforts, and working more collaboratively together. The review seeks to highlight if and whether it is advantageous to involve MDTs or multidisciplinary teams in online consultations and or educational sessions via the renal patient support group, social media platform, or a website to improve health literacy for CKD patients or those going through chronic kidney disease. This review seeks to understand if it would be helpful to have follow-up online consultations with healthcare professionals following routine appointments. And the general background around this is that technology can improve patient documentation through more complete records with fewer errors and improved ease and efficiency. Providing documented education can also reduce unnecessary complexity, reduce duplication, and improve collaboration between multidisciplinary teams. Suffice to say that things like telemedicine and links for video consultations, imaging and laboratory data, that sort of understanding can also or could also enable those allied health professionals normally who are not traditionally patient facing can be also involved to provide understanding or information or educational support through the delivery of online approach. CKD are doing things that for patients with CKD through this through this effort and online can bring together teams to be more involved in discussions with CKD patients more remotely or via through one-to-one online discussions or consultations, or through group consultations. Of course, any education provided would require documenting and transferring of information and connectivity of any future technologies or effort that through whether it's through through online or social media has to be obviously moderated and supportive. Then that also means that in that context, where related to best practice, it should involve good links between electronic patient records and be within the remit of the general data protection record or regulation, and be compliant to that particular form of data protection to ensure that to ensure that patient care is secure, confidential, and of course upheld. This poster presentation also highlights that CKD, chronic kidney disease, affects patients from various backgrounds across age groups. Therefore, patients may see would through their disease trajectory for the long-term condition, and that trajectory and the life course of this condition, they would see various healthcare professionals, and of course best practice should really be ultimately inclusive of and take into account that these patients will have various conditions, various areas of health being if not compromised, they will be affected, and that then therefore would require patients seeing or having follow-ups or links with the various different allied health professionals. And so, for example, best practice would encourage that if someone has something wrong, if a patient, for example, has something wrong with for example their with their leg, with a limb, or relating to bone or bone health, yes, there is a basis to speak to communicate with a renal specialist, a nephrologist, but ultimately informed decision should actually lead the patient and carer, if the patient requires a carer, to be signposted or involve a link with someone in orthopedics, or in someone who can look and explore around physiotherapy or that kind of side of things. So it may be a case of improving aspects around movement, etc. So in that regard, and so best practice should be about involvement and signposting patients to someone from an orthopedic lead, and if it's something to do with bone health, then common sense should be that the patient should be speaking to someone in orthopedics and not nephrology. So that should be part and parcel of what allied health professional involvement should be about, and in that regard, health professionals who are also involved with patient care have opportunity to document understanding around aspect of healthcare that has been provided, whether educational or informational support, or actual physical intervention, or an interventional aspect of their care. They have opportunity to document in the patient record as well. This then leads into the point really about, apart from the patient and public involvement entity, this will alleviate, or should really alleviate, structural and cultural isolation. So basically, where for a very long time, patients and professionals together, really, in their own way, would perceive different aspects of the disease in different ways, the long-term condition in different ways, and that means the perspective and the way that different the two entities, whether patient or professional, would actually approach different the aspects of healthcare in different ways. And actually, that's not only dangerous because it causes further fragmentation in aspects of health service, but also general segregation in if not in approach, then actually physically it causes it can cause a professional discourtesy toward each other. So that's then obviously on a general reflection and point of practice, it is why why different professionals, whether from the nursing background or from a clinician background, or different allied health professional background, generally, and obviously patients themselves, everyone is working, whilst there may be an element of togetherness on paper, and aspects around framework and guidelines. Actual reality is that everyone is still has a mindset and thinking that is in silo, and that actually reflects on point of practice, where everyone is generally throughout different NHS trusts and different areas of nephrology practice, people are the reality is everyone is still working in silos, and whilst that might be the case, this work highlights that approach can be bettered or remedied through joint having mutual goals, as well as a mutual respect for different parts of the patient's journey, the patient journey and life course, as well, and in work by and research by Phelps and his team that were one of the first teams in 2014 to highlight the work around patient view in their work, and highlighted the uptake around that particular electronic patient record and the opportunity that lies within that. And then the renal patient support group has that role as well, has a role in providing a space where patients can basically use the platform to the online social media group to help inform shared decision making, as well as and the pediatric equivalent, which is the kidney disease and renal support group for kids, or KDARS, and between the two groups have been proactively doing that effort, nearly close to 2 decades, and really and truly these spaces do offer that support, and it is about integrating the link between what happens, for example, at appointments and what happens in and between different time spaces throughout the patient's healthcare journey, and there's research also by ESOM, a team in the US who are focused on who heavily focused their research in 2019 on the educational aspect, and for those on for pre-dialysis and actually during dialysis. The research that they've done is quite informative, and basically they've highlighted where education is required to support CKD patients, especially around treatment options, and actually a little bit before that time as well, the team highlighted that patients, another two researchers, Bartlett and in 2019 and Simmons in 2016, also highlighted and kind of reinforced retrospectively in some regard that with the work by ESOM, that patients want to be educated, they want that understanding, they want to be more involved, and actually have a mutual, it is that mutual respect in that regard. But where health practice is concerned, but irrespective of whether aspects of their healthcare are delivered through online or face-to-face, they want to be have that educational understanding earlier, so that they can actually proactively have aspects of their health documented more readily, readily and actually more accessible in that regard. So education should be documented electronically between healthcare sectors to ensure correct and timely referrals, and where especially that's necessary, and patients and professionals need to be more involved, and ultimately this poster really highlights that our understanding really informs that that there is wide-ranging diversity surrounding patients, different backgrounds, and different age groups, and who are going through CKD, and an overall CKD educational pathway is needed, owing to health inefficiencies, and if not inefficiencies, then where different aspects of nephrology practice could well are compromised in one way or another, especially given the last 18 months to 2 years, where the pandemic has caused further potentially further segregation or fragmentation in aspects of healthcare, and so patients generally in later stages of CKD need that educational support and informational support, and so they can adjust accordingly. And that to emphasize really that is actually something that should be done, that educational support and where they need understanding should be throughout their throughout the journey. And having apps and technology is all well and good to a point, but nothing beats having an actual health professional, whether online or face to face, so that they get that real understanding in real time, and to help with that aspect of adjustment, and especially where given the experiences that they have to go through, time really should their time should necessitate more reassurance around aspects of their care, and more robustness where there is allied health professional working, and an MDT effort between different professionals, and this would hopefully and should offset, especially where patients are either feel either that either inequality, or they could be at risk of being isolated in aspects of their care. And again, just to finally say that this is has been a real opportunity to provide this a summary of this work through this poster presentation. I'd like to acknowledge my colleagues, collaborators, and those who have actually been part of different efforts towards the work around the RPSG and KDARS, and they are listed in this poster presentation, and I'd like to acknowledge and thank them for their time in providing perspective. I hope that this poster presentation has been informative. If you wanted to, if anyone wanted to follow up, please feel free to do so. This work has been manuscripted for a peer review journal, and we are very. I've been very fortunate enough to put this in that format and in that regard as well. Thank you for listening, and I again thank you for UK Kidney Week for allowing me the opportunity to present this work in this manner. Thank you.